Poliomyelitis, more commonly known as polio, is caused by poliovirus. Polio can spread from person to person and is known to infect the spinal cord, which causes paralysis. A large problem is that not only can a poliovirus cause paralysis of an arm or leg, but it can also paralyze the diaphragm and muscles required for breathing. Jumping for a little bit, we now know poliomyelitis is caused by three serotypes of poliovirus: poliovirus 1 or PV1, poliovirus 2 or PV2, and poliovirus 3 or PV3. These viruses are non-enveloped single-stranded RNA viruses that are classified as members of the genus Enterovirus and the family Picornaviridae. The three serotypes are just different enough that immunity to one serotype typically doesn't provide immunity for other serotypes. As far as transmission goes, it turns out that polioviruses can only infect humans. Polioviruses are quite stable under natural conditions and have been found in places like swimming pools. They typically enter the body through the mouth via the fecal-oral route, infect the throat and intestinal tract, and then move on to invade the bloodstream. Nursing diagnosis of poliomyelitis include imbalanced nutrition, less than body requirement related to anorexia, nausea, and vomiting, ineffective thermoregulation related to the infection process, ineffective breathing pattern related to muscle paralysis, acute pain related to the infection that attacks the nerve, and impaired physical mobility related to paralysis. Today, we know that over 70% of people infected with poliovirus will not have a single visible symptom. About a quarter of people might have flu-like symptoms that last only a few days, but for the most part, the immune system can conquer the infection and achieve complete recovery. It is therefore interesting to think about the large outbreaks of the past, considering that only around 1% of cases involve weakness or paralysis. For those people that do show serious symptoms, they might experience paresthesia, which is a feeling of pins and needles in the legs, meningitis, which is an inflammation of the membrane surrounding the brain and spinal cord, or paralysis, which is the most severe symptom. In some cases, muscle pain, weakness, or paralysis can come back anywhere from 15 to 40 years after an infection, which is called post-polio syndrome. For poliovirus infections, the main types of treatment involve supportive care, which includes rest, fluids, pain medication, and in some cases, an iron lung. Medical management also includes physical therapy, total hip arthroplasty, and diet. There are two types of vaccines that can prevent polio. The first is an inactivated poliovirus vaccine, or IPV, which is given as an injection in the leg or arm. And the second is an oral poliovirus vaccine, or OPV. For the prognosis, in non-paralytic poliomyelitis, recovery is complete. In paralytic poliomyelitis, about 2/3 of patients have residual permanent weakness. Bulbar paralysis is more likely to resolve than peripheral paralysis. Mortality is 4 to 6%, but increases to 10 to 20% in adults and in patients with bulbar disease. And that is all about poliomyelitis. Thank you and have a good day.